Welcome to Straight Outta Health IT. Getting into health tech is rough, but here's an unfiltered dialogue of healthcare leaders and influencers covering a wide variety of issues affecting healthcare and the health tech industry. And now your host, Christopher Cunny.
Hello, everyone. This is Christopher Cunny again, and I want to welcome you back for another edition of Straight Out of Health IT. Today, we're going to be talking about what I call the good, bad, and ugly of social determinants of health. I'm sure many of you have heard this term over and over the past couple of years now. It seems to be a topic of importance, finally, to many healthcare systems and organizations and leaders. And we have on our show today an individual who is a subject matter expert on the topic. And so I'm so very, very excited to have with us John Matthew Douglas. And let me, before I bring him on, just give you a quick rundown of John Matthew's background and career. He has a very extensive background and a very illustrious career. So let me start with that. So John Matthew Douglas is a United States Army veteran. Thank you for your service. And a graduate of the State University of New York. He's a published author, a dedicated lifelong learner, and has more than 20 years of healthcare industry experience. He currently serves as a strategy partner with Lonely Entrepreneur, which features the Black and Hispanic Entrepreneur Initiative. John Matthew's career journey involves a very diverse background in the healthcare industry, including pharmaceuticals, home health, long-term care, healthcare group purchasing, pharmacy benefits, managed care, medical products, information technology, healthcare high reliability. Very, very extensive background. He's also been a sought-after expert on the topic of social determinants of health, and is the founder of LinkedIn's very first Social Determinants of Health Education Thought Leader Group Collaborative. He's also a former upstate New York Leukemia and Lymphoma Society board member, a founder of iPressForward mentor program, and is a stakeholder, a National Points of Light affiliate of Upstate New York Community Mentor Award winner. Finally, John Matthew is a recipient of the special recognition from the New York State Legislature resolution in Albany, New York, County Resolution, the State Assembly of New York recognition of community service, and a recipient of the New York Anthem Blue Cross Blue Shield 2021 Whole Health Hero Award, which highlights an extraordinary leadership in essential workers, healthcare providers, and nonprofit organizations and businesses sought to improve healthcare wellness and the safety of New Yorkers under the most difficult conditions during the COVID pandemic. Wow, what an extensive background, and who better to have on our podcast today than John Matthew Douglas. So John, thank you for joining the podcast, and I look forward to having a very interesting conversation with you today.
Christopher, as I mentioned, this is a pleasure, and just excited to be here today. Looking forward to speaking with you.
Well, before we get started, obviously I read down your background, your bio here, but that doesn't always truly reflect the journey that you've been on in this industry. So I want to take a few minutes for you, if you don't mind, and kind of share with us your story. Share with us your journey in healthcare. How did you get into healthcare? Why are you in it? Some of the things that have stood out that have impacted your career in both a positive, maybe in a challenging way. Just curious about who you are and why you're doing what you're doing today.
That's a great question. It's interesting. So, sometimes, our passions find us. In fact, all
Exactly.
of the times in life, our passions find us. I, by way of a very, very dear friend of mine, who's in pharmaceutical sales, he's focused on the oncology side of things. Many years ago, he had a conversation with me, and he said, "You know what? You would be a great pharmaceutical sales representative." And at that time, I never thought much about healthcare in my mind. healthcare was, okay, I'm sick, I'm going to go to my doctor, or
Exactly.
more likely then, because of where I come from, I'm sick, I'm going to go to the ER. So I didn't really have a perspective on healthcare. So I took him up on his offer to meet his sales manager. And long story short, my healthcare journey began. And it's interesting, I think back to those days, and, Bristol Myers Squibb, to their credit, they did just an exceptional job from the standpoint of training on product and service, product from a therapeutics standpoint. And I had focused in on diabetes and cardiovascular disease. And it's interesting, again, I think back to then, and, I left my training, and in my mind, I thought everyone that was in doctor's office had diabetes and heart disease, because that was just the nature of the training. It was just so robust in that regard.
Exactly.
But I quickly learned that healthcare was far much more than that. The market was very volatile then in pharmaceutical, and it remains to some extent now. But I weathered the storm after, their restructuring, and I found myself, having, as you mentioned in the intro, literally a tapestry of healthcare experience subsequent to that job. And along the way, I, under the guidance of mentors who I respected in the healthcare group purchasing realm, I pursued my degree in healthcare business administration, and it was enlightening. And it was very much towards the end of that piece of my career journey that I had an experience where I learned about the economic burden of healthcare inequity.
Right.
A document, or paper, I should say, that was published collaboratively between Johns Hopkins University and the University of Maryland School of Public Health. And it was eye-opening for me, and an epiphany. And, so that for me at that time, that was when there was this change in trajectory and focus of my career. I wanted to be a part of that, because at the end of the day, healthcare was not equitable.
Exactly.
The disparities, and, contrary to the opinion of many within this country, or I should say a certain sector in this country, contrary to their opinion, foregoing the opportunity to address inequities in healthcare, notwithstanding society at large, that economic burden is something, if we mitigate that, it would, in many respects, mitigate some of the catastrophic costs we're seeing in healthcare. So that was my motivation and journey, in terms of, the direction that I wanted to go in. And it was just, just the passion and inquisitive nature, over these last 10 years, really,
Sure.
that have led me to just take a deep dive into the social determinants of health realm. And after having, several employment opportunities with noteworthy companies within the United States, i.e. Unitas, which is doing an incredible job, I decided that, I wanted to do something unique. Exactly. And I wanted to do something, that was not so much a competition of market share as much as a platform for collaboration and sharing of ideas, because at the end of the day, when we look at social determinants of health, the lift is so heavy.
Right.
Healthcare in and of itself is complex. But then when we look at social determinants of health, the complexity there it's just remarkable.
So I'm sorry to interrupt you, but I didn't want to, no, that's a great dialogue, great feedback. Thank you so much for providing some of that context. I did want to delve a little bit into, you mentioned a report that you read and how it really changed and shifted your paradigm about the industry. I'm curious to learn a little bit more about what were some of the things that came out of that report. And then can you provide to the audience, some historical context on why we still struggle with health disparities here in the United States?
Yeah, absolutely. So that study, for me, the takeaways were, the economic piece of it. Essentially what they found was there was an economic burden associated with basically avoiding addressing healthcare inequity. That economic burden to the United States over a period of 3 years, and I'm paraphrasing here, but over a period of 3 years, equated to north of $200 billion. And then when you when you extrapolate that over the United States economy in that same period of time, according to this study, we were looking at a burden of north of $1 trillion. And so again, when you look at the U.S. healthcare costs per year. The expenditures are about $3.8 trillion. So
Exactly.
one can begin to realize there's a tremendous opportunity by addressing the inequities of healthcare and what it would mean. So, that information is what really created, that paradigm shift for me in my career. And when I think about, to your second point, the inequities of healthcare, what are some of the challenges? It's education. And it's interesting because when you look at social determinants of health, the neglected social determinant, and the evidence is overwhelming, is education, because by way of education, individuals become empowered, whether that's in education through mentoring, whether it's education through resources and entrepreneurialism and being an entrepreneur. These are the types of things that empower one economically and thus give an individual the opportunity to really change their life, change their community in an impactful way.
Absolutely.
So that's essentially my thought on what's wrong with, if you would, with social determinants of health. We're not focusing on education. We're not giving enough investment in the upstream solutions, because it's there that we're going to see the sustainable transformation. The downstream applications of social determinants, and I don't want to take anything away from them because they're very important. It's really, two areas that need to move in lockstep. The downstream applications of transportation, food, housing, those things are very important.
Exactly.
But in many respects, the reason why there's such an emphasis on that is because of the economic benefit to our hospitals and health systems by addressing those issues, i.e., it's been projected, and this would be prior to COVID-19, because that did create an outlier type of environment in terms of statistics. But it's been projected that per annual, avoidable hospital readmissions cost the United States north of $17 billion. And a large percentage of those avoidable hospital readmissions are linked to social issues that have not been addressed.
Exactly.
So the idea is, if we address those social issues, then we can mitigate those costs and burdens on the healthcare system. But again, these are downstream. These are where we're being reactive to the conditions and environment, as opposed to being proactive and investing upstream in education and really honing in on those areas that, once we empower individuals, we essentially, as James Brown once said, I don't want anyone to give me anything, just open up the door and I'll get it myself.
Absolutely.
And we can do that, and we can do it in a very constructive and productive way.
So it's interesting, it's interesting that you really emphasize, in terms of those reports that, and research that's been done, and kind of the business and economic aspect of social determinants of health on the healthcare system. But, what I don't hear, to your point, is what's the moral aspect of this as well, too. It doesn't appear that, one of the major drivers to this is it's just morally the right thing to do. Why are we not providing adequate healthcare services, access to healthcare to underserved communities, as we have done for other communities, especially communities of Black and Brown and diverse groups of people?
Absolutely. I agree with you wholeheartedly. And it is a moral responsibility. I think back to Martin Luther King Jr.'s conversation with healthcare leaders in the mid-'60s, where he spoke to all the injustices, that we see. The greatest among those injustices exist within healthcare and healthcare injustice. And so, yes, absolutely. This is a moral conversation as much as it is a business conversation, as much as it is a health and well-being conversation. But, truly, healthcare, without health, if we subtract that from the equation with the United States, without health, we are vulnerable. COVID-19 is exemplified that. So, yeah, absolutely. This is a moral conversation and debate without question.
So talk to me a little bit. It sounds like, obviously you are an advocate and an evangelist for addressing this issue head on. What are you doing within your current role to bring greater light to this issue to healthcare organizations and other community leaders that may have could influence or impact, the social determinant of health paradigm that health systems are dealing with and social service organizations are dealing with, and just the community as a whole, and becoming more aware of these gaps that we have and putting in place programs and initiatives to start to close the gap?
Great. And so that, again, a great question. I'll go back to the LinkedIn group that I founded, which, I'm blessed and fortunate to collaborate with some marvelous individuals who, are employed by the likes of CVS Health, Aetna, who co-managed the group with me, and others. And, it is within that space, that we provide information, honest information, not always consistent with, what the popular opinion is from the standpoint of social determinants of health, but data and information that essentially positions those that are within the group to move forward and begin to do things that can be more impactful and create tangible results. In addition to that, and this is a result of my career path and what I've discerned from social determinants of health. I've embarked upon partnership working with the Lonely Entrepreneur, focusing on, two initiatives they have, which is the Black and Hispanic Entrepreneur Initiative. And this is really important because what we've done basically and are doing within the company, we are empowering Black and Hispanics and others in at-risk communities, if you would, under the auspices of giving them resources that would allow them to advance from an entrepreneurial perspective. And I'll take a step back. The founder of our company, Michael Demure, a genius in his own right. He founded a company in the early 2000s, weathered the storm in 2008 when the economy kind of fizzled out a little bit. And he was able to, maintain and build his company back to a successful level and ultimately sold it. And he felt, as you say, a moral responsibility to do something substantial. And so he created the Lonely Entrepreneur. And subsequent to that, created and founded the Entrepreneur Initiatives for Hispanic and Black. So we're focusing on that. I've been with the organization now about a month. We've reached out to a number of cities, states, local government, payer organizations, funding groups, and we're looking at collaborating and bringing, into fold in social determinants of health from an upstream perspective, the entrepreneurial resources that we have within the Hispanic and Black Entrepreneurial Initiative. And, and I'd be remiss if I didn't add, tremendous opportunity for our HBCUs as well.
Absolutely. Well, I'm glad to hear, about the program. It's the first, quite honestly, that I've heard of it, but I'm looking forward to learning more about the lonely entrepreneur. And I can definitely relate to that. I ran my own company for about 9 years, and many times I felt a very lonely entrepreneur.
Yes.
Dealing with that as a person of color trying to do business in the healthcare technology space. I wanted to, you talk about, going back upstream as it relates to social determinants of health. And if you go further upstream, you get to there's a book called The Political Determinants of Health.
Yes.
Right. And there's how, politics, policies and legislation has impacted health disparities. Can you provide some perspective on that for our audience and maybe what you guys may be doing around advocacy as it relates to addressing these things from a policy perspective?
That's a great question. When you think about policy and politics and, social determinants and why there's such a focus on it, the healthcare policies as they exist, because of the waning representation of diversity, equity, inclusion, they fall short in many respects because policies are created on a day-to-day basis. And historically, there was very little thought of or understood in terms of the depths of challenges among minority populations. And so as a result, we have policies that are not conducive to creating an equitable position of good health and wellness in our communities. And so again, from our standpoint, it gets back, when I say our, I'm just referring to the lonely entrepreneur, notwithstanding my own personal convictions. It really gets down to education, economy, and empowerment. And when you become empowered in that respect, through education and from a socioeconomic perspective, you're now in a position not only to do better for yourself, but to do better from the standpoint of influencing those political leaders who are out there who may not always have your best interests at heart and are, for whatever reason, naive or arguably in denial in terms of, what it would mean to create a more inclusive society and policies that are reflective of the collective as opposed to, just a fraction of the collective.
Right. No, absolutely. I think a lot of the policies that have been put in place to what we believe is somehow trying to provide a social responsibility to certain communities that actually have negatively impacted them as well. And they're not just policies that are specific to healthcare, but to your point, education, for example. We know statistics have shown that the higher the person's education level is, the more likelihood of their health being, their life expectancy being longer as well as some of the challenges we've had in our own community because of some of the policies that were enacted that took advantage of people of color as basically, research lab or rats and things like the Tuskegee experiment and others.
Yes.
We don't have to go into great detail on that. That's, I think people understood that, within the Black and brown communities, there has been, just like in some cases around law enforcement, there's been some level of mistrust around the medical community as well.
Yes.
Sometimes we wait until the issue has gotten so acute that, we have to go to the emergency room or to have more evasive procedures taken. But by that time, the ability to prevent those things from happening, we've missed that window of opportunity.
Yeah, and not only that, Christopher, one other area is of concern. When we think about, the various morbidities that we're faced with day to day, for instance, cancer, diabetes, and the list goes on and on, or mortalities, go on and on. You think about these things and you look at the disparities in these areas. Many times it's because, the clinical studies themselves that the pharmaceutical companies are leaning into, they're not representative of minority populations. So, it's really hard to lean into the data strongly, when we're looking at, a lot of these clinical studies, most notably, for example, oncology studies. And, there's a big push to do something about that. So I commend healthcare for embracing that challenge and running with it and trying to turn that around. But, these are real issues. But again, it gets back to that diversity, equity, and inclusion conversation. When we look at it, from a healthcare perspective, clinical study perspective, when we're not delving deeply into, diverse populations, there's reason to question the outcomes that we're seeing, or at least, be in a position to ask, why are we not including minorities? And if they are, what then would we see, within this data?
Yeah, absolutely. And I do think we have to change the narrative because we have to keep a focus there, Black and brown communities, but we also have to change the narrative around social determinants of health, and to say that umbrella is much broader than just those two specific segments of the population. That could mean poor whites in West Virginia. That could mean our veterans who are coming back, who are dealing with the LGBTQ community and others. And so this whole concept around social determinants of health has a much broader tent of individuals that we should be taking and providing a lens upon, and how we, again, close the gap into the quality of care that's being delivered to those individuals. I did want to quickly touch, because I know we're running out of time, what can our own communities do to empower ourselves? Sometimes we do wait until we look to the federal government or our state and local governments to help, be the savior for our communities, but we should take our own personal responsibility to addressing some of these social determinants of health. You mentioned, for example, in the Black and brown community, the HBCUs, the historically Black colleges and universities, and what they could be doing to help provide, access, education, and advocacy to these types of challenges within our healthcare delivery model. Just curious, from your perspective, what should we as a community be doing more of to help close these gaps as well?
That's a brilliant question. In my mind, each one teach one. Social determinants of health, you and I, we know what it is. And there are others, African American, who know what it is, Hispanics who know what it is. But then when you go into the greater populations, if you speak to the average American or minority, whether, impoverished or, Black, Hispanic, and you say the word social determinant, they look at you like, what are you talking about? So again, this is an opportunity for education. And, I want to share this with you, I think kind of a plug, but still, I think this is appropriate. Many years ago, I started my mentorship program, iPressForward, and it was the very nature of that program that was structured around informing middle school students through the auspices of a diverse group of mentors, not only social determinants of health, but other career paths, and allowing them to see the world outside of where they live, as well as the opportunities within them to make a difference. So, in some, that's the opportunity we have. Those who are dialed in and tuned in to social determinants of health, take it upon yourself to wear that badge and talk to your fellow brothers and sisters about, what it is, what it would mean to address it, and why they themselves should take an active role in informing themselves about social determinants, because that's the only way we're really going to have the opportunity to truly take advantage of this opportunity where the light is being shined so brightly on social determinants. Again, this is about those who are marginalized. So if those who are marginalized can become more aware, again, through the auspices of each one, teach one, then we'll be in a better position to leverage, this time in history, for the betterment of all.
Well, and I couldn't say that any better. And what a great way to kind of start to wrap this segment up as well, too. I mean, we could talk for the next hour again on all the different responses around with social determinants of health. And I'll have to definitely invite you back for us to have a further conversation about it. But I do want to wrap the conversation up. And one of the things I like to do at the end is have what I call this rapid round, and some general questions about learning more about you as an individual, things you do when you're not advocating for others. And so I'll start this, and the first thing comes to your head, just answer. So first question, favorite dessert?
Favorite dessert is going to be blueberry pie.
Blueberry pie. Haven't heard that one yet. That's a good one. Favorite TV show growing up as a kid?
Favorite TV show growing up. I used to like to watch Fred Sanford.
Yes, absolutely. Sanford and Son, one of my favorite.
Yeah.
Favorite hobby or pastime currently?
Golf.
One of my favorite pastimes, one of my worst pastimes, depending on how I'm playing. Favorite artist, author, musician, performer, or all the above? Anyone you want to just give a shout out to?
A brother by the name of Gregory Porter.
Gregory Porter.
Yeah, jazz performer, very interesting cat. He came from a background of looking at a career in football, but a challenge came about whereby he could not pursue his football career. Mm-hmm. And on his mother's deathbed, he made a promise to pursue his passion, which was singing. He went back to New York City, took voice lessons, put together a band. Wow. Now he travels the world. I encourage you to look him up, Gregory Porter. He's
Gregory Porter. Yeah,
very fascinating.
I'm going to put him on my music list for sure. 2 things on your bucket list you have completed.
Wow, bucket list. I've published several articles. In retrospect, hindsight, I never thought, the opportunity would present, but I was invited to collaborate on a number of articles, and then an opportunity presented for me to work with the gentleman who heads up HIT Consulting. Mm-hmm. And I was able to lean into several additional articles around social determinants of health. So that bucket list was satisfied.
That sounds good. Great.
Yeah.
And then 2 things that are still on your bucket list yet to complete.
On my bucket list yet to complete. I want to go to New Orleans. I've never been there.
Oh, wow.
That's one that's on my bucket list.
Yeah. You got to go to New Orleans.
Oh, yeah. And my next bucket list, it's interesting how life and time is. I've come to this crossroad in my life, and I'm a part of the lonely entrepreneur. My bucket list, if I could do this in such a way and have it hit the ground and hit the mark effectively, touch base with every payer organization in the United States and show them how we can educate and empower through entrepreneurialism and make a significant difference in the communities that they're striving to make.
That's great. And then the last question, the most important one, brandy, scotch, bourbon, vodka, or tequila?
Bourbon.
That's great. One of my favorite as well too. Actually, my vodka person who switched to bourbon about 10 years ago.
Oh yeah,
I can appreciate that as well.
Hands down.
Absolutely. Well, I want to thank you so much again, for taking time out of your very busy schedule, and John Matthew, to come and share with us your perspective on social determinants of health. I want to commend you on what you're doing in your role to further the narrative, the commitment that you're making through Lonely Entrepreneur and your other, civic activities. And I look forward to bringing you back at a later date, and we can continue this conversation or explore other things that are passionate to you as well. So thank you so much for your time, and I appreciate you being a part of my show.
The pleasure is mine, Christopher. Stay the course, brother.
Thank you, sir. I appreciate that. Well, that wraps it up, everyone, for another session of Straight Out of Health IT. I want to thank each and every one of you again for supporting my podcast. Please comment, both, constructive feedback, non-constructive, anything that you're passionate about. If you disagree with any of the topics or agree, we'd love to hear from you. The only way we can have constructive feedback is if you share your view of the world. Thank you so much. God bless you. Have a great day. Take care.
Thank you so much for listening to Straight Outta Health IT. We hope you enjoyed today's guest. For more unfiltered dialogue of healthcare leaders and influencers, be sure to tune in next week. For the show notes, transcripts, and resources, please visit Apple Podcasts, Spotify, or your favorite streaming platform. We invite you to give us feedback by reaching out to Christopher Cunny on LinkedIn, just searching for Straight Outta Health IT, and you'll find us. We are constantly having live discussions about diverse topics in the industry.